Hey all, I'm going to try to give you some basic Glidescope intubation tips on pro tips that I've learned that have made this a whole lot easier, and that will help you if you do this occasionally or even a lot. So before each video, I want to tell you what to focus on. On this first picture, the most important thing here is the proper placement of the cords on your Glidescope screen. So you want the cords to be a little bit to the upper right of midline. And let me show you what I mean here. If you look at these cords are positioned to the upper part of the screen. They are to the right of midline, and you want the anterior cords and epiglottis slightly out of the screen. And you want them to be somewhat distant. If you're too close, you're going to see how much trouble you have getting the tube in. So in general, just kind of watch this video. Notice how that I marched down the tongue slowly, looking at the mouth. You don't cram it in there, and if you do, you're only going to see pink mush. And you're not going to know where you are. And only after you march down there and know where you are do you look at the screen. And then you try to get it on the correct place in the screen. So you can read through this on your own. The idea is to look at this and then look at the video and then maybe come back to the tips that I write down afterwards. So let's play video. You notice that I'm looking at the mouth here, which you can't see, but I am. And now that we were down there, we're going to look now at the screen and try to get it in the proper positioning, as we mentioned before. Upper and to the right. And you'll notice that the tube goes right into the right place. If my cords were positioned further to the left, it would not go in that directly. The Glidescope would be in the way. Okay. So now it's going to be really common to be too posterior and you're stuck on the corniculate cartilage or the aeroepiglottic fold, any of the posterior structures, and you're trying to get the blade in or the tube in, and you're going to contort your mouth as well as the tube in much different ways to try to force it up there, and it just doesn't work. And there are some things that you can do that are very simple that will help get it into the right place. One of the most important things is going to be just to back out sometimes. So watch this video. See, I'm stuck on the posterior. I can lift it up, lift my thumb up, and that's going to lift the tip of the tube up, and it still wasn't enough. Trying to move it, it's not going forward, so I back up some, reposition the scope, and the tube goes right in. And you're going to find that that works very frequently if you will do it that way. So now we're going to look at how to drive the ET tube, just some tips on how to do that. It's with your thumb. If you go thumb up and down, it's going to move the ET tube up and down essentially. If you move your thumb to the right and the left, you're going to move the tube to the right and to the left. And it's very easy to do. I'm going to show you that clip in just a second. Watch this manipulation of the tube. As you can see, you can move it left and right all you want to. If you're down low, you can move it up and in. This is actually a good video also, just to note that there are people walking around, there's commotion going around, and your job is to keep steady eye focused on the screen, not watch what's going on all around you, because this is going to be very common. Focus. Here are a few just additional tips to learning how to drive the ET tube. And you want to try even before as you're setting up, you want to make sure you don't just cram the stylet down into the tube. You want it to be loose enough to where you can move it around with your thumb. So play with that before you do your intubation. And you're going to see, as we mentioned, if you move up, the ET tube tip goes up slightly, sometimes enough to get you where you need to be. And you can do the best you can to stay anterior as you're going into the throat area. So stay anterior with your tip of your ET tube, and you're going to hold the tube at the top so you can drive the stylet with the thumb, as we've mentioned before. So here's a couple of videos that will show you how you're driving with your thumb. You can see you go side to side very easily. It moves quite a bit. And then just by driving it up and down, you can see how much the tip moves up and down. Just a very simple little drawing over here. You can see how much you can move into
You
it.
can see if I happen to get below the cords, I can just push my thumb up a little bit and it'll bring the tip right into that, and then you can go through. Again, I'm below the cords. Move my thumb up some. It goes right to where I need it to be. If you happen to be off to the side and low, turn it to the side. This way. And then I can lift up. And then I can advance.
So manipulating the stylet can make a massive difference.
Here you can see if I happen to get below.
So I'm going to show you just again on the mannequin how you can manipulate the ET tube all you want to move it into the correct place. Okay, here's another video where there's commotion in the background just like there would be in any code or intubation typically. So you have to focus on what's going on. You can see we're going to enter and be a little bit posterior, and this is very typical. Try to manipulate with my thumb, put the ET tube up a little bit, which drives the end of the tube up, and sometimes you can go right in. And if this doesn't work and you are still stuck in the posterior and you're trying to move it around and trying to get up and over it, which is very common, and I've seen myself and other people just struggle back here. If you'll just gently, calmly come back a little bit with the scope blade, you can often put the tube right into place. So just take a deep breath, back out a little bit, and then go right into place. And hopefully those tips will help you.